All right, I have 7:01 on my computer clock, so I'm going to call the June, boy, what a way to start the meeting. The July 28th, 2020 Middlebury Select Board meeting to order. Thank you everyone for joining us. Just a little housekeeping before we begin. An effort to give everyone participating equal opportunity to comment and ask questions. We will be using the following guidelines tonight. The Select Board will open discussion to the public at the start of the topic. If you'd like to comment or ask a question, please use the raise hand or send a message using the chat feature to Assistant Town Manager Chris English. Instructions on how to do this are included in a document on the Select Board packet. Members of the public will be given 1 minute to comment with a reminder at 15 seconds. Please prepare and use your time effectively. Additional time may be granted if available after all have had an opportunity to speak. Okay. Approval of the agenda.
So the approval of the agenda.
Is that Victor? Farhad moved. Who seconded? Do I have a second? I see Nick. Hello, Nick. So I'm sorry. Who made the? Farhad made the motion. Victor, did you second?
No, I thought I made the motion.
Oh, okay.
Either one doesn't matter.
Okay.
It's okay. I'll second.
Okay. Thank you, Farhad. Any changes, additions? We do have need for an executive session at the end of the meeting tonight. Any other changes? Okay, hearing none, all in favor of the agenda, please signify with a thumbs up. Brian, if you're voting, can you just say so?
Aye.
Okay, all in favor. Thank you. Approval of the minutes from the July 14th, 2020 regular Select Board meeting.
So moved.
Thank you, Farhad. Is there a second?
Second.
Thank you, Victor. Any changes, corrections, additions?
I have a couple of typos, I think. Line 249.
Okay.
It says Brown said his church is, it should be having after that, I think. Is that correct?
I don't have it right up in front of
Line 249. Anybody has it?
me, so I'll take your word for it.
Okay. The way it says is Brown said his church is have 4 training sessions. I think it should be having.
Having, okay. Okay.
And I have another one for line 445.
I'm sorry, there's some background noise. What did you say? What line, Farhad?
Line 445.
445. Okay, thank you.
The beginning of it, it says Seeley, there should be a word that says said, she wanted to remind. The said is missing.
Okay. Okay. Did anyone else have any corrections, changes? No? Okay, all in favor of the minutes from July 14th with those 2 minor corrections, please signify with a thumbs up. Brian, if you could indicate by voice.
Aye.
There's 2 abstentions.
2 abstentions.
That's right. I'm abstaining, Heather.
Is that going to do the mirroring thing? Yes.
Abstaining? Okay, we'll figure it out. All right, citizen comments. If you are here for something that is not on the agenda, could you please let me know? From July 14th with those 2 minor corrections, with a thumbs up. Brian, if you could indicate my voice. I can hear myself. Okay, we'll move on. Is Chief Hanley on?
I'm here.
Okay.
It's going through your ears.
Here I am.
Honey, you want to bring your...
Chief, if you could give your update on the local management, emergency management, that would be great.
Sure, I'll be brief. We're continuing to meet weekly with the Attorney General to get any updates or any policy changes regarding enforcement of the governor's orders and what exactly they'd like us to do, as well as getting the weekly briefings from the state. We're kind of at a fragile piece right now with COVID. The numbers are going very slow, but really expect that to change as things go on, as this thing is creeping up from point south and east. And we're getting a lot of visitors here in town, a lot of out-of-state people. So we just, again, reiterated over and over again, protect yourself. Wear your mask out in public, keep your hands clean, and don't be wearing your mask 20 days in a row. You got to wash this thing so it doesn't become a biology experiment. Today we went out and we started some of our compliance visits around, we collect the data from the state as far as complaints on compliance issues. So we collect all those, and today we started going around and just making sure people are complying as best they can. They're not coerced visits. It's more education, as the governor wants us to do. So we're taking care of that. Bringing the town's poster around to see if they'll post that in their window, the one that requires them to have masks. The requirement gets a little more stringent come August 1st. Again, it's a requirement and it's not a mandate, so there's no enforcement component with it, but they really want to get serious and make sure that our numbers don't jump up. So that's where we're at. We'll continue some of these things tomorrow. We've also been asked by the state to visit every first and third class liquor licensee in town to just remind them that they have to be careful because around the country, those are the big places where. Anyway, we're going about our business with that, and that's where we're at.
Cast a Zoom meeting. I don't know if I can cast a Zoom meeting.
So, thank you, Chief. I appreciate the update. I'm sorry. Kathleen, hang on just a minute, Dan. I see your hand. Kathleen, Lindsay's muted and I can't unmute her. Can you find her and unmute her, please? Sorry, Dan, you had a question? Go ahead.
Yeah, Chief, I just had one question. I know you said that we have a lot of visitors in town right now, and you said it earlier this week, we have a lot of visitors in town. I think I can attest from the lodging industry in town that we don't have people staying at the inns. You know, we're at, minimal occupancy right now. So there must be a lot of day people coming through, or I don't understand.
Yeah, people come from the lake, staying at the lake and coming in. A lot of Airbnb activity. I've spoken with a number of Airbnb folks who have asked for some guidance and advice on what to do when they get visitors. So, and just anecdotally, our guys are just seeing a lot of out-of-state plates, not just New York and New Hampshire. We're seeing a lot from Pennsylvania, New Jersey, New York, Southern New York area, Connecticut. So that's just kind of a bird's eye view and not a really specific data set.
Yeah, that's an advantage of being an Airbnb. You can operate under the radar, and you don't have any jurisdiction of the state over you with monitoring or taxes or anything like that. So I understand.
Well, that's right. I mean, we don't know who an Airbnb is, other than we run into them incidentally. So we don't know how many Airbnbs are out there, how many people are just renting a guest room in their home. So, right, we have no control of that, but we are seeing license plates and things like that. So that's how we base our assessment.
Great, thank you.
Chief, one quick question. Do they have new signage for the new mandate from the governor available for businesses?
I've not seen it yet. We are using the one that the town came up with. Kathleen prepared a bunch of them for us to hand out. And I did get a whole package of mask suggestions from the state that we're also asking if people would post those as well.
All right, thank you.
Okay, did anyone else have questions for Chief Hanley? Okay, thank you, Chief. I appreciate the update. Okay, now we'll move on to representatives from Middlebury College, including Dr. Peluso and Special Assistant to the President, Associate Secretary of the Corporation and Director of Community Relations, Sue Ritter, They will update us on the community, or update the community on the college's plans to reopen to the campus to students in the fall.
Oh, okay. Heather, who's going to lead off from the college?
Oh, Lori's here.
Okay, let me see if I can unmute her. Okay, Laura, you should be unmuted.
Great, thanks. I need Stephanie Neal to share slides with us. There we go. Great. Okay, wonderful. Thank you so much, Heather. I want to thank the Select Board and all the people of this wonderful community for having us here today at this meeting, and to give us and myself and my colleagues an opportunity to share our thinking and our process of decision-making around the fall semester. In the landscape of higher education, I believe deeply that our town-gown relationship is an extraordinary one. And in that spirit, your questions and engagement with us over the last several months have been essential to our thinking and our broader approach in these incredibly difficult times. I want to thank everyone on this call for that and for an opportunity to work with you again now. So if you could move ahead. So I'm going to be just doing a brief overview and then turning it over to my colleagues. First is to share with you the principle that we have been working with, which is maximizing safety for all while maintaining educational opportunity. And you can see our calendar more broadly. Next slide. These are the people that are presenting to you tonight. Dr. Mark Peluso, our college physician, who's also head of the Vermont Higher Education COVID Health Group. Derek Doucette, who is our wonderful Dean of Students, who has experience in risk management. Barbara McCall, whose MPH is in college health education. And Jen Kazmerzak, who's our environmental health and safety coordinator, double engineering degree and 20 years of experience in environmental health and safety. And several members of the senior leadership group are also with us tonight. Next slide. Our decisions are entirely grounded in science. We are working on guidance from experts, CDC, NIH, and the Vermont Department of Health. Our models are of successful states and parts of Europe and Asia, and we are focused constantly on risk mitigation as we see our environment changing at the moment, and I'll be addressing that in a second. We've just released our 2021 website, which contains all of our COVID-19 related information, including our recently published Return to Campus Guide. Next slide, please. This is Governor Scott's reopening plan. Mark Peluso is going to be addressing a lot of this, but as you see this slide, you can see all of the requirements. Next slide. And you can see that Middlebury's health and safety requirements meet all of those and exceed many of them, including the reduced density plans, the pre-arrival quarantine, the testing, the dynamic testing throughout the semester, as well as twice upon arrival, as well as highly restricted travel policies. Next slide. The new reality of late July, it's very important to us. We are constantly monitoring it. I think it should be of concern to everyone. We are working very much on our communication and education plan. Looks like we are being
Yeah, someone is invading us.
Zoom bombed. Yeah, I'm going to just keep going and ask your forbearance. And we are analyzing national trends, but I want to say for everybody, we will not open if it is not safe to do so. It's incredibly important that everybody hear that. Next slide, please. Our health and safety team, you can see all of that group there. That is our crisis management team, which is 20 different people. Next slide. We also have an emergency management team, which is about 30 different people, which we're very, very proud of. I am not going to be able to read these slides. So what I might do is just continue to talk with you as we move forward, unless there is a way, Chris, that you could get our guest to move away. That would be quite wonderful.
It's difficult to know who it is, unfortunately.
Yeah. Okay. Let me just see if I can bring our slides up.
want me to try, Lori, it's Kathleen, would you like me to, I'm open to suggestions.
Yeah, if you could send me, Kathleen, the slide deck.
Would you like me to try to share my screen and bring up the?
If that would be fine also. The key is to if we share it again, we might get Zoom bombed again. So here we go. Hang on just a sec. I have it now. And I am going to be simply talking from those slides. If everyone's okay with that, my fear is that if we, yeah, good. All right, that looks clear. Can everyone hear me?
Mm-hmm.
Okay,
Yes.
great. Thanks. Okay, that's not going to work. I'm just going to keep talking from my slides, given that sharing slides is clearly going to be creating a problem. So I'd like everyone to listen carefully as we move forward on this. So our team is, first of all, the most important crisis management team consisting of 20 different people, emergency management team of about 30 different people, health and safety task force, education task force, which includes faculty, staff, and students, as well as administrators, is constantly at work, and that's about 20 different folks. We also are meeting with our external partners, many of whom you will know, and many of whom are on this call, as well as 3 or 4 of the top folks at Porter, as well as the leaders within the town. We communicate with them weekly now, once every 2 weeks. We're in constant communication with other major leaders in the town, such as the Chamber of Commerce and Addison County Economic Development Group, and many, many others. Our other external conversation partners are the Vermont Department of Health, the Consortium on Financing Higher Education, which is an Ivy League plus group that Middlebury is a part of. Obviously the NESCAC group, as well as the Association of Vermont Independent Colleges. So we're very much nationally plugged in. We also have consulted with MID parents, who are chief infectious disease specialists at major hospitals, so 3 or 4 of them that we're regularly consulting with, as well as MID alums who have experience in AI, as well as contact tracing and scientific modeling of what our particular community might look like, as well as close conversation with our UVM colleagues. We are making decisions based on the Johns Hopkins Council of Higher Education Safe Return site. We can share that with you, and I know we can do so a little bit later when the slides get posted. And we also have a Middlebury checklist that mirrors that Johns Hopkins site very carefully. The work that we are completing this summer, we have finished our return to campus protocols and policies. We have finished our training for Res Life staff design, and we are ongoing with that for our residential life staff. We're working with community members on our residential spaces, and I want to return to that a little bit later. We are training our public safety. At the moment, we have determined our locations for testing, as well as a walkthrough of what that's going to look like with mathematical modeling attached. We also have final coordination with the state for tracing, as well as our new app, which is
It's the Selectboard.
an app that is designed by the wonderful person who designed Watson in Jeopardy. He's an AI expert, David Franny. He's an incredibly wonderful and interesting person. That app is in the final stages and will be implemented for all faculty, students, and staff in August. The questions we're hearing from the community are incredibly important, and I wanted to share them with you. And the team here is going to be answering many of them. The first is Porter capacity, and I'm going to briefly answer them really quickly now. Yes, we have a engagement and plan with the group at Porter. We have capacity, and we are ready for surge. Mark can share more around that if in fact we need to do that. Town campus travel is another concern that community members have brought to us. We will be more restrictive than Vermont in phase 1, and we'll share a little bit more about those restrictions for our campus as you hear from our presenters. Our testing and tracing capacity, we have several partners, one that is a wonderful, very highly respected lab in Massachusetts, the Broad Institute. Mark will be sharing more about that. And we will have other partners, backup partners, in addition to the state, which is our main tracing partner. The key thing that I think a lot of folks are concerned about is the behavior of our off-campus students. And Derek Doucette will be sharing special education programs that we are developing with and for these students, their peer-to-peer work, as well as special intensified sanctions for those students. And I will be meeting with them personally because this community matters so much to us, and we know how important that behavior is. Several of you have asked about how to communicate, and we want to share with you COVID info. I'll put it in the chat at middlebury.edu. Our volume there is fairly low, which is interesting to us because we know that folks want to engage with it. So please do write. Julia Ferrante is with us. She is our COVID communicator. She will get you the material as quickly as possible of what you need and how you might need it. And we've been able to answer all the questions that have come in through that. So please do write at that address. Finally, I'm delighted to say that we are planning a town college supplement in the Addison Independent, which is a local resource guide to COVID-19. That'll be messages from the editor, town, and college as we continue to work so closely together.
Nick, do you want to just give a break and watch this?
And finally, I wanted to just remind everybody what drives our approach. Safety and educational mission is at the heart of our decision-making. It is based in the science, and the conservative approach that we took to going remote in March prevails in our approach now. The same folks are making those decisions. If it is not safe to open, we will not do so. And I just want to end by, before I turn it over to Mark, to say that every year there's a different focus in Middlebury's mission, which is through a commitment to immersive learning, Middlebury prepares students to lead engaged, consequential, and creative lives, contribute to their communities, and address the world's most challenging problems. Right now, that contribution to community is the #1 focus that we are asking our students, our faculty and staff to engage with. Thank you so much. Wanted to make sure that you all knew by my presence here how important this community and its safety is to all of us. And with that, I will turn it over to Dr. Peluso.
Thank you so much, Lori. And I have to say that health and safety has been on the front of our mind since January when we started hearing about COVID. And I just wanted to share some of the more salient points of our plan, particularly around what's being done around increasing COVID-19 prevalence in the country. Does our mitigation plan address this new reality? And what metrics are going to inform our decision-making as we look at the weeks and months to come? It's hard to see, you don't have the slides, but there's some really nice graphics about increasing prevalence in the parts of the country, the Southeast, Texas, the Pacific Coast, and there's decreasing prevalence in the Northeast, which is reassuring. We obviously want to keep it that way. When you look at the CDC website, you can see lots of data sets, and I think the one you're going to want to focus on if you do go there is to look at the, not so much the total cases, the total case count, but really what the 7-day rolling average is. And that's what we've been watching, and it's picking up really the California, Texas, and the Southeast as areas to be very concerned about. Meanwhile, New England, New York, and Massachusetts, while they have high case counts and light up on the total case count, they don't have as many newer cases, which is reassuring. We know that can change. But I think we have to focus on not just states, but on counties, because states are big. Counties are smaller, as we know. And if you looked at just a map of Vermont, you would see that Chittenden County has most of the cases in Vermont, whereas Addison County only has a few. And if you look at the rolling 7-day average across the country in certain counties, even in California, there are places where the activity is very low. Same for Texas, less so for Florida. But when we think about where people are coming from, I think it's not just a state, but it's also where in the state are they coming from, and that really matters. What I also want to point out, though, is that regardless of where someone's coming from, our plan that we rolled out in June was designed for this kind of increase to occur. We felt that we needed to anticipate an increase, and we hope that there wasn't one. But all the steps that I'm going to review had higher case counts in the country in mind. As Lori pointed out, our plan is based on guidance from the CDC, NIH, American College Health Association, and also the Vermont Department of Health. I meet weekly with Dr. Levine, our health commissioner, and his colleagues, Tracy Dolan, the deputy commissioner, Patsy Kelso, our state epidemiologist. Rena Holmes has been very involved, and we've learned a lot through her involvement with the maternal and child health and school programs. But we also meet with all of the Vermont institutions of higher education, our peer institutions in NESCAC, and as Laurie pointed out, lots of infectious disease and critical care specialists. And we go over our plan.
Excuse me,
and,
Mark.
and our
Would you like to give, excuse me, it's Kathleen. Would you like to give the slides another try? And we'll quickly get off if it doesn't work out.
Happy to.
Okay. Stephanie, are you available to do that, or would you like me to do it?
Yeah, that's great. So this is if we could go back one slide, that might be more familiar to people. That's the state of Vermont. You can see Chittenden County has more total cases than Addison County, and it's just an illustration that there are different rates in different parts of different states. And next, please. Apply that to California. These are total cases. These are not slides of a rolling 7-day average, and these are from the CDC. Next, please. I've reviewed this information. These are some of the guidelines that we use to make and vet and review our plan. Next slide, please. Here are my colleagues that I meet with regularly. They've just been absolutely terrific in terms of listening to our concerns and coming up with effective and creative solutions for us. Next, please. I want to go over a few definitions, and I think it's important for people to really understand that the difference between isolation and quarantine. Isolation, as it says, separates sick people with disease, from people who are not sick, whereas quarantine separates people who are not sick but have been exposed, and we wait to see if they become sick or if we can get them tested. Also, for COVID, a close contact is defined as someone who's within 6 feet of an infected person for at least 15 minutes. So passing someone on the sidewalk, unless they cough or sneeze right in your face, is unlikely to be considered a contact. Next, please. I'm just going to go over a few phases of our plan. We're in pre-arrival right now, and our students are getting very directed messaging on what they can expect when they come to Middlebury, some of the rules and regulations that they're going to have to follow in this new reality. But it's being presented in a way that is meaningful to them and is designed to get the best behavior, best yield from that information. There's an online education course and pledge signing that are mandatory. And one of the key features of our plan is a 14-day at-home quarantine. And there'll be messaging directed to them for that, a lot of outreach, making sure that they're doing it and advising them on questions they have, such as, can I go out of my house and exercise? Different things, questions that they've been asking us. We're also recommending that they travel directly to campus, following all the good instructions around distancing, hygiene, and face coverings. When they get to campus, we'll be in arrival phase. And next slide, please. The first place they come to on campus is our testing center, and that's day 0 testing. From there, they're going to go right to a room quarantine situation where they'll be asked to stay in their room, with the exception of using the bathroom or going to the end of the hall to get a meal that will be delivered to them. We anticipate having the day 0 test results within 24 hours of receipt at the lab. Any positive cases we're going to isolate immediately. Any all negative cases will then go into campus quarantine. So our students are going to remain on campus, not being able to go into town, walk at the TAM, or do any of those things. They are going to be on campus until we get a negative result on day 7. So that's our testing approach. They'll also be doing daily symptom and temperature checks using an app that I'll show you in a minute, and there's compliance tracking on that app. There'll be no visitors to campus. We've got gathering size and travel restrictions. And these, the same rules apply. It's important to our off-campus students that are planning to study on campus this fall, but are living off campus. They're going to be restricted to their home, except to come to and from campus for orientation activities. We're coordinating all of this and informing our partner at Porter Hospital. Everything we do is designed to preserve our community resource. We take that very seriously. Next slide, please. The next phase we're going to get into will be a stabilizing, hopefully a stabilizing phase. We're going to continue the visitor and campus restrictions. There may be some slight increase in size of gatherings if conditions permit. We're going to transition away from arrival testing to targeted dynamic testing twice weekly. We have signed contracts with a great testing vendor for that. There'll be, as I said, dedicated isolation houses. I'll show you those in a minute. And we will be doing contact tracing. We'll be using the Department of Health. We talked about that again on our call today, this morning. But we've also trained college staff as backup. One thing that we're adding this year is telemedicine. It is 24/7. It has mental health and medical issues that can be dealt with for students on or off campus. If the health center is closed, this is another way to preserve our resources at Porter. The same rules will apply for off-campus and on-campus students. And we've got a lot of environmental and administrative controls to share. Next slide, please. This is just an example of the app that we'll be using, the daily symptom check, temperature check, and testing results. And you can see that the app has QR codes that can be scanned, and we can turn on or off an individual, whether they can access buildings, classes, dining halls, et cetera, depending on if they're complying with our policies or whether or not they have a positive test. Next slide, please. Testing is important. It's critical to our success. I've mentioned the types of testing we're doing and that there's a 24-hour turnaround time. That's with the Broad Institute. I've also spoken with many testing vendors, and I'm in the process of developing some agreements around testing in case something ever happened to the Broad. We'll have some testing agreements in reserve. There are many other vendors not seen there. Those are just some of the bigger ones. Next slide, please. These are our isolation spaces. Mumford House is our main isolation space. There will be no students living in there at the start of school. Hopefully there aren't any living in there, which would mean we have no cases. But if we do get a positive case, that's exactly where they're going to go. That's completely surrounded by campus property. We're able to access that quickly from the health center. And we've got a plan in place for assistance from Addison County Home Health and Hospice if we need to use them. Some of the smaller houses that we have, there's a couple pictures there, would be used for either isolation or for students with high-risk health conditions that might need to get away and recover somewhere, or get away if someone in their group has COVID. I also show Bread Loaf. We're keeping that in reserve in case we need that for additional quarantine space. And we've got very detailed plans on how to track all the students that would be moving in and around campus. Next, please. Contact tracing, again, we'll go through the Department of Health. If you go to their website, you can see their SARA alert system, which helps them with their contact tracing. We have had our own staff go through the Johns Hopkins course. We've got 15 contact tracers ready to go if the Department of Health needs assistance. Next slide, please. Just some of the updates we've had in terms of responding to rising infection rates. We constantly review the entire plan. It's a fluid document, and we have to do that to stay current. I'm watching national trends in a way that I didn't have to do earlier in the summer. We're keeping a close eye on locations and even international trends, to be frank. We have a lot of communications with our students on what to expect. The Return to Campus Guide just went out, and the Health Pledge also went out, and also how we're going to enforce things. You'll hear about that shortly. As I said, we're formalizing agreements for backup testing capacity, because as volumes go up in the United States, testing becomes more difficult to obtain and lead times increase. We are definitely revising our operational expectations with our external partners, particularly with Porter Hospital and some of the other folks listed there. Next slide, please. We're also looking at good news. And I love this study from the CDC. It was published about a week or two ago. 2 hairstylists in Missouri had COVID. They spent over 15 minutes with about 140 people. They were wearing face coverings. Their clients were wearing face coverings. The cases were discovered. Everyone was contact traced and followed, and no one came down with the illness. It's just one success story. I think there's other successes recently about the progress of vaccines, and that also looks promising. It speaks to some of the things we're looking at in terms of how we're going to make decisions in the future. What you see, next slide, please, is this is a model from the Institute of Health Metrics and Evaluation. The top is the United States, lower is Vermont, and you can see on the U.S. Section, as you go over towards the right, there's 3 lines. The top line is if we don't ease restrictions. The middle line is if things just go as planned, and the lower line is if masks are used more broadly. And you can see the effectiveness of masks. In Vermont, we had our peak in the spring, and they're not projecting another peak. We're not counting on that. There are lots of other models that we're looking at, but I think it's a reassuring view at this point. We watched, next slide, please. We watched the Department of Health website very closely. We look at this every day, looking at new cases, where cases are occurring. Next slide, please. We also look at our UVM Health Network very closely to understand capacity, both testing amounts and rates. Next slide. But also across the network, availability of medical surgical beds, ICU beds, ventilators. And I'm not showing you all the slides here, but this is just a snapshot of the entire network, which is the large section in the upper right. But then all the other hospitals are represented, and we can even see Porter, which is circled. It's really helpful. So when we think about metrics, I think about sort of singular metrics that would change our decisions. That would be a governor's order to go remote. It could be a change in the virulence of the virus, making it even more deadly or more concerning. Or it could go the other way, and it could be less virulent, which would be reassuring. There could be a vaccine or a medication that we can use that would help us and move us in a better direction. The rest of the factors, some of the ones I've mentioned, are multivariate, and we have to look at them as parts of a puzzle or parts of a picture and not hang our hats on any one particular metric. I'll give you an example. The top line there, the 7-day case incidence, if it's getting higher and higher into a very high alert stage, well, okay, that's fine. Where is that occurring? Is it isolated? Is it widespread throughout a state or an area? And I think further down, you'll see the 4th from the bottom under in campus situation, what's the percentage of new cases from quarantine contacts? Here you want a higher number, because if you're having cases here on campus or off campus, and where we can identify them through contact tracing, that's a controlled outbreak. If we're seeing lower percentages, that's more concerning because that's indicative of community spread. So take that and combine it with a variety of these other factors, including PPE availability, how our students are behaving. All those things are important and paint a picture of how we should move either to more restrictive standing or settings, or even going remote. I think stakeholder behavior, student behavior is on everyone's mind. And at this point, I'd like to turn it over to Dean of Students, Derek Doucette.
Thanks, Mark. As Mark mentioned, I'm Derek Doucette. I serve as the Dean of Students. And as President Patton stated, we know that many of your most pressing concerns focus on student behavior. Natalie, could you advance the slides, please? Thank you. We understand those concerns, and I'm going to walk through some of the key elements of our plan to address them with you tonight. I'll focus on the scope of oversight. Who specifically does our plan apply to? Our health pledge, what in general terms will we expect from students this fall? An overview of the policy itself to provide a bit more detail about how we'll respond when necessary. A sample of our sanctioning matrix to give you an idea of the sorts of penalties we might impose if we need to. Some thoughts about students residing off campus, a subject which I know is of particular interest. Next slide, please. I'll begin with this excerpt from the college's handbook that specifies our scope of oversight over student behavior. As indicated in the first call out, that one at the top there, all students in the area, regardless of whether they live on campus or off, and of their enrollment status, are subject to our disciplinary policies. The second call out, the one on the bottom there, indicates that the Conduct policies apply to conduct occurring both on or near campus. It does not restrict our oversight to conduct occurring only on campus. And it specifically mentions a priority of maintaining the safety of the Middlebury community. In other words, whether a student's currently enrolled or on leave, living on campus or off, they're subject to our conduct policies. I want you to file that away for a moment. It will be important in a few minutes again. Next slide, please. All of our students will be required to indicate their commitment to community health by signing a pledge prior to return. It's important that students commit explicitly to doing their part in maintaining community health. Most will take this commitment seriously, and for them, the pledge will help solidify that commitment. We do know a few will not, and in those cases, the pledge will serve as a useful accountability tool later. The most important elements of the pledge are indicated again in those callouts. First of all, its emphasis on personal and shared responsibility. We all have a part to play in maintaining community health, and students are very much a part of that. Its specific mention of the Middlebury community as a whole, it does not limit the scope of the pledge to the campus community. Its affirmation that students must educate themselves on our expectations as well as relevant state health protocols, and will help them do that. The recent release of the Return to Campus Guide and Health Pledge and Conduct Policy, all of which are publicly available on our website, are very useful tools, and we're using them extensively to communicate with students. And finally, it's acknowledgement that students understand that non-compliance will have serious consequences, and we'll touch on that in a little more detail soon as well. Next slide, please. Let's take a quick look at some of the important characteristics of the policy itself. First, consistent with the governor's orders, public health is our priority. The bar for removal from campus and/or suspension will be far lower than in a typical year. And I don't say that lightly. The stakes are too high, and introducing elevated levels of risk to the community won't be tolerated. Our primary goal in our conduct policy is rapid and effective risk mitigation. What that means in practice is that the administrative processes will apply will be quick and efficient, and students facing removal from campus wishing to appeal will be required to quarantine pending that outcome. Of course, students have the right to appeal the decision, but we need to mitigate risk while that is playing out. Multiple staff will be prepared to accept and act upon concerning reports, and what they'll do is bring them to the attention of the Office of Community Standards, the office that will be responsible for considering complaints and levying sanctions where necessary. And our sanctions will be proportionate to the level of elevated risk a particular behavior has the potential to introduce to the community. This is critical. We won't wait for infection to result from a behavior to respond forcefully. Potential risk introduced into the community is enough to trigger our responses. Next slide, please. Here's a look at our sampling matrix. It helps outline some of the behaviors that we're thinking about and how we might respond to them. The green bar across the top is examples of low impact behaviors. An example might be occasionally forgetting to wear a face covering but immediately complying when reminded, or forgetting on occasion to submit a daily health monitoring report, but again, immediately complying upon reminder. While a high impact behavior, those in the red bar, might include holding an unauthorized gathering in violation of group size or social distancing expectations, whether that occurs on campus or off. And again, our responses will be proportionate to that projected level of potential risk. Our sanctions will be progressive. While a single minor infraction will be met with an educational sanction, for example, in that upper left-hand corner of the green bar, repeated infractions demonstrate an unwillingness to change behavior, and they could, even if minor in isolation, fairly quickly escalate to a penalty that could include removal from campus. I want to call your attention in particular to the prevalence of removal from campus and suspension in that matrix. I've circled them. They feature prominently in each of the three bands. And there are other tools at our disposal as well. Students who are asked to leave campus and end up coming back could be issued a no trespass order. We're fully prepared to do that. And suspension, if necessary, is on the table too. It's not something any of us wants to do, but we're willing to do it if needed. Next slide, please. I want one more point about the sanctioning matrix. Well, actual sanctions will depend on the specifics of a particular incident. They could be more or less severe than those shown in that chart. I just want to be clear about that. The table is not prescriptive. We'll be guided by the actual circumstances of each incident. That's just an example. So let's turn to off-campus students. We're well aware that many of your concerns center around off-campus student behavior and the important role that it will have in maintaining or undermining community health this term. We share those. I want to talk about how we're going to address them. There are 3 categories of students who may be living off campus in the community this year. The first are those whom we've approved to live off campus, study on campus, but live off campus. And there are, as there are in a typical year, somewhere in the vicinity of 100, sometimes a few less. Those students are all subject to all of our conduct policies, all arrival and quarantine expectations, the 2 rounds of arrival testing, ongoing random testing, just as all our other students are, and they're required to comply with all state health and safety protocols. There will also be some number of students who will be enrolled as fully remote learners. That is, they're not actually taking classes on campus, but will choose to live in the area. We do understand that some students will choose to do that. And then finally, there are some students who will likely choose to take a leave of absence this term, but live in the area. These latter 2 groups are also subject to our disciplinary policies and are expected to observe all Vermont health and safety protocols. You'll recall our scope of oversight from earlier in my discussion. We need to know who all of these students are and where they live so that we can effectively work with them. We're requiring all students falling into any of these categories to provide us with their local address information. And I want to be clear, failure to do so would itself be a significant conduct violation to which we'd respond. Next slide, please. Again, we know these concerns are pressing, and our plans to address them have several components, a number of which are new for this fall. For example, new for this year, we're actually conducting some research with our off-campus living students to understand what barriers they anticipate to cooperation with our expectations so that we can tailor our plans to remove those barriers to the greatest extent possible. This is a proven health education strategy, and Barbara McCall, my colleague, will talk more about our educational efforts in a moment. Clear expectations are key for accountability, and so we recently published the Return to Campus Guide, the Health Pledge, and the Conduct Policy. All are publicly available on the college's website, and we're using them extensively to educate students on our expectations. Students approved to live off campus will be required to meet with the Associate Dean of Community Standards, one of my staff, and with me prior to the start of the term so that we can personally convey our expectations and answer questions. And President Patton has graciously agreed to attend those meetings as well, signaling the importance we place on this issue. This level of focus and attention is also new. A communication specifically targeting students living off campus, whatever their enrollment status, as well as their families, will go out shortly. Enlisting families in helping set expectations and manage behaviors in this way for our off-campus students is also a new effort for us. And then finally, we're devising a plan to conduct in-town rounds in which our staff will be moving about town to periodically check in with off-campus students. This too is new. Eyes on the ground are not something we've had in the past, and we intend to introduce them this year. Next slide, please. So it's often said that the best predictor of future actions is past performance, and I want to close with a few thoughts about that idea. Students have remained on campus since March. Most have been good neighbors, and there is no evidence any contributed to the spread of the illness. The few students on campus through the spring who were unable to meet our expectations were quietly but immediately removed from campus. This is not something that the community saw, but it happened. It happened rapidly and effectively. I was personally involved, and I want to assure you that that's the approach we'll take this fall as well. We won't tolerate behaviors that increase risk to the community, and we have good plans in place to address them. So thank you very much. And I'll now turn it over to my colleague, Barbara McCall, who will outline our comprehensive evidence-based health education plan to enlist students as partners in maintaining a healthy community and limit the frequency with which we need to take the steps I've just described.
Great, thank you so much, Derek. If I could have the next slide. For the sake of my audio quality on DSL, I'm going to keep my video off for this portion. I'm Barbara McCall, I'm the Director of Health and Wellness Education, and as I thought about what to share with you all this evening, I thought about a few questions that community members may be asking. How will we reach students? Does health education work? And will students take this seriously? And I know that that third question is paramount. Next slide, please. So reaching students. We have a number of modalities that we're going to be using this fall and frankly throughout the entire year. Online courses, folks have mentioned those already, that we have a required pre-arrival course for all students regardless of the where or how they are studying. Embedded within that course will be our health pledge, where students will have to sign it, acknowledge it, and assure us that they have read and that they understand the expectations of what it means to be a part of the Middlebury community. In addition, we're working specifically with student leaders who are set to arrive on August 18th in the first wave of students, and we're providing them with education around COVID-19 communication and leadership. We know that students turn to each other first for information, and we want to make sure that our student leaders who will be here first, who will be spending the most amount of time with us this summer, who will be setting the tone and really modeling for our community what it means to be in campus quarantine, that they have the tools, the skills, the confidence, and the competence to have really meaningful conversations around community enforcement and around supporting healthy behaviors. We also know that mental health is a concern for our students every day, and it is a newly highly important concern during COVID-19. So we're also supplying them with information around connection, belonging, and mental health, letting them know not just what they can't do based on our campus phasing and our reopening, but what they can do to increase connection, to show each other that they care, and to increase everybody's commitment and connection to the Middlebury community. We're also working with our colleagues in communications on a social media health promotion campaign, tentatively titled Mid-Quarantine, where we'll be amplifying and highlighting the voices, experiences, worries, concerns, and quarantine hacks that our students have for each other through social media. We know, again, that hearing their voices from each other is an incredibly effective education tool. And so we'll first be highlighting student leaders as they begin their home quarantine in over a week. We're also going to be hiring some COVID-19 health education assistants to help promote skill building and to enforce in a community-minded way the health behaviors that we're asking all of our students to engage in. And then we're going to be revisiting those online required courses as we move through the phases so that our education is tailored to students as we move throughout the year. Derek also mentioned targeted education, and we're specifically here thinking about our off-campus students, first years, transfers and exchange students, and our remote learners. What are some of the new subpopulations that we need to consider in our health education campaigns? That's a question we're asking ourselves and that we'll be exploring. Next slide, please. In terms of what works, we have quite a history of success in health education and higher education. Despite some of the recent media coverage, we know that binge drinking on college campuses is actually at an all-time low. For the first time, we are below 30%, where college-age students who are studying are actually approaching the alcohol and other drug use of their non-college counterparts who tend to use more moderately. We also have great success in a number of these areas that are on the screen: mental health promotion, sexual and relationship violence, bystander intervention, stress management, and more. Here at Middlebury, locally, we have cut recidivism in half over the last few years when it comes to alcohol and other drug violations, simply by changing the way that we approach students educationally, by providing interventions that meet them where they're at, that invite their reflections and ask them about their goals and dreams for their time at Middlebury and beyond. And we'll be using everything that we know in the field of college health and everything that has worked so far for us at Middlebury to address not only COVID-19 health behaviors, but the intersection of COVID-19 and all of these other health issues that are on the screen right now. Next slide, please. In terms of whether or not students will take this seriously, one big step that we're taking is to really make sure that all of our educational efforts are placed into realistic context, and that we aren't just taking our best guess as educators or our best guess as student affairs staff as to what that context is, but we are directly asking our students. Yesterday, we launched a COVID-19 health education behavior survey, and we've heard from about 20% of our students in the last 24 hours already. We're asking them questions based on the health belief model. We ask them how they feel they are susceptible to COVID-19. We want to hear from them what are the benefits of being able to return to Middlebury and complying with our COVID-19 policies and expectations. As Derek mentioned, we also want to hear about the barriers so that we can help them remove barriers, work around barriers, or at the very least acknowledge that there are barriers. I know for me there have been. It's hard to be away from friends and family. It's hard to adapt to new ways of being in our community, and we expect that students will be facing some of those same things. We also want to contextualize the worries that our students have. We know that COVID-19 and the pandemic in general has really disrupted all of our lives, but that there are other intersecting issues affecting our students and affecting our community here in the town of Middlebury. And we want to make sure that we are taking a holistic approach and looking at the intersections of not only COVID-19 with other health issues, but with other concerns and worries at the local, national, and global level. So we're going to be asking students these questions throughout the fall to see how things change or shift and allow them to tell us what's feeling hard and what's feeling easy so we can reward those easy, great behaviors and really provide them skill-based support around the things that are feeling hard. Next slide, please. So lastly, when we think about taking it seriously, not only are we contextualizing, not only are we asking students for their input so we can take their lived experience and reflect it back to them, we're also using what works, what we know works in terms of health behavior modification theory. Here's what we know does not work. Shaming and blaming, fear and scare tactics, and yelling, which for Generation Z in this day and age equates to writing emails in all caps. And we know what does work. We know that we need to accurately discuss the susceptibility that our students, faculty, staff, and frankly, the larger town have to COVID-19. That we have to acknowledge and be realistic that there are barriers, and despite those barriers, we can work together as a community to be safe. We can promote tangible benefits. We can talk to students about the things that will happen that are good for them and good for everyone when we all work together on this issue. All of those things build what we call social solidarity so that we can emphasize the individual contributions that each of us, including our students, can make to the collective. That we are in this together. It's a barrier and an insulator against loneliness, against poor mental health outcomes. It's a way that we can all be healthy together physically, mentally, and socially. We can be really clear about the how and the why. We are asking students to do what we are asking in addition to the what. And we can make sure, as Derek said, that there are swift and clear consequences. Education and prevention is not just the way we talk about things at the outset or at the front end. It is also how we walk the walk, how we say we're going to do something, and then we do it. We know that all of this education can be incredibly successful, but it is only one piece of the COVID-19 puzzle or part of any health issue puzzle. We also need to take into consideration the larger campus environment. And so with that, I'll turn it over to Jen Kazmierzak from Environmental Health and Safety to speak to that.
Great, thank you, Barbara. Next slide, please. I will make some brief comments on how we are preparing our campus and our employees for fall opening, focusing on our approach to controlling COVID-19 exposure. Some questions that we've been hearing from the community are, how will employees work on campus safely, and how will we prevent employees from bringing the virus to campus? The answer to both of these questions is multi-layered, and over the next few minutes, I will share some examples of some of the controls and protective measures that are part of our strategy. Next slide, please. We approach health and safety through a hazard assessment. Those in the very high risk and high risk groups are healthcare workers who are performing aerosol generating procedures or support staff who might be in close contact with COVID-19 patients. Some of our employees who perform tasks in these categories are our health center and public safety staff, and they are trained and provided with personal protective equipment, including respiratory protection. Most people fall into the lower and medium risk levels. Tasks that require frequent and prolonged close contact with other individuals are considered at medium risk. And low risk exposure is when tasks can be performed while avoiding close contact with others and inappropriate environments. Virtual or remote activities or in-person activities that allow for proper physical distancing and keep exposure risk at a lower level. In order to reduce the risk level, control measures are used. Next slide, please. What's shown here is a hierarchy of hazard controls, and this is widely used in occupational health and safety to group hazard controls by effectiveness. The most effective way to control a hazard is by elimination or substitution, where you physically remove or replace the hazard. In the case of COVID-19, this will only be possible when there is an effective vaccine or treatment available. Engineering controls involve isolating people from the hazard without relying on an individual's behavior. Examples of engineering controls that we are using on campus are ventilation and barriers. Where possible, we are increasing fresh air exchange, updating our HVAC filters, and in some locations, we are deploying portable room air cleaners. We are also adding physical barriers such as plastic shielding to public-facing areas that may require in-person transactions. Administrative controls change the way people work. Adjustments to scheduling, such as using staggered shifts or working alternate days in the office, implementing touch-free transactions, or installing visual cues in dining halls to direct traffic flow are a few examples of administrative controls that we're using. You see that PPE shows up at the bottom of the hierarchy, and that is because it is actually considered the least effective means of controlling hazards. PPE relies on proper training, proper use, and should always be used as a last option for controlling a hazard, and only if other levels of this hierarchy cannot be used. Next slide, please. Here are a few other important measures that are part of our exposure control plan. All faculty, staff, and students are required to complete a daily health check to verify they don't have any potential COVID-19 symptoms or exposure. Cleaning and disinfecting our spaces is critical to maintaining a healthy campus. Our custodial services team has modified their daily routines to give more attention to high traffic and high use areas. Physical distancing is a part of our new reality on campus. Every space on our campus, from classrooms to elevators to lounges, being evaluated and assigned a COVID-19 safety max occupancy. A diagram of a physically distanced classroom is shown here. All of our classrooms have been adjusted to reduce density, and classroom furniture is currently being adjusted to match the new occupancy to allow for students and faculty to maintain physical distancing during in-person classes. Next slide, please. We have had employees working on campus throughout the pandemic. In the spring, they provided essential services to our students who remain living on campus. And throughout the summer, we have phased employees back as state guidelines have allowed. Our exposure control plan has continued to evolve as state requirements have changed. All employees before working on campus are required to take an online training and sign a health pledge. What you've heard about tonight, our Return to Campus Guide was recently released on the college website, and this informs both our campus community and the wider community of our detailed plans. Next slide, please. You've heard tonight about our phased approach for opening. So deciding to advance from one phase to another will take into consideration many criteria. You heard Mark Peluso talk about this. If health conditions require us to move back to a more restrictive phase, we will be prepared to do so. I thought it would be helpful to present a few sections of the appendix, which shows up in our Return to Campus Guide, that shows details of our phased approach. I won't go through all the details, but I'll just point out an example around face coverings. So during phase 1, which is our campus quarantine, face coverings will be strictly required both indoors and outdoors with very few exceptions. In phase 2, which we will consider moving to in mid-September only if health conditions allow, we'll slightly reduce some of these restrictions. For example, we will consider allowing face coverings to be removed outdoors if physical distancing can be maintained and if it's consistent with current state guidance. In the third phase, you can see that these restrictions may relax a bit more. I do want to point out the visitor section because it is important for our community to know that we will not be able to fully open up our campus to visitors during the fall semester. We look forward to the future when we can return to hosting our community for recreation and for events. Finally, I would like to just leave you with some thoughts related to our phased approach. As Mark mentioned, our reopening process actually begins on August 4th when the first group of student leaders start their pre-arrival quarantine. This 14-day quarantine is one of the first layers of our multi-layered approach to opening campus. I have had the opportunity to personally correspond with many students and parents through our COVID info email, which we offer to the community as a way of responding to detailed questions about our plans. A number of questions are related to quarantine and travel, with many specific inquiries from students and their families who want to be sure that they're complying with Vermont and college guidelines. Many have also shared that they are grateful for the opportunity to return to Middlebury and for the plans that we have in place to make that possible. One example of this is an email that came from the brother of a first-year student. He wrote to ask for more details about his sister's quarantine requirements, explaining that she is taking the guidelines very seriously, and he wanted to be sure his family was meeting all of the requirements so they could be supportive. My other colleagues have shared with you the expectations, educational programming, and strict conduct policies we have put in place for our students. I wanted to share this story, which is just one of dozens I could tell about the students who are working diligently to understand and take on their shared responsibility for health and safety. Next slide, please. On behalf of my Middlebury colleagues, I want to thank the members of the community for attending tonight, and thank you to the Select Board for providing us this time to present our plans to the community.
Okay. Thank you, all of you, for that great presentation. I would just like to remind those joining us from the community tonight that this presentation is posted in the Select Board packet on the Town of Middlebury website. So if you missed any part of it or want to go back and review any part of it, it is available on the Town of Middlebury website under the Select Board packets for tonight's meeting. So, Stephanie,
Heather?
could you, yes.
We did receive a number of questions
Okay.
from people in the community, and we summarized them into 9 questions. How would you like to proceed with those? Would you like me to read them off at the top of this question and answer period?
Sure, I think that would be a great way to start, Kathleen. Stephanie, can you stop sharing your screen now? That would be great. Okay, now I can see everyone a little better. Thank you. So Kathleen, do you want to read your questions?
Sure.
Okay.
And number 1, does the college have a phased approach to reopening, similar to the state of Vermont's approach to gradually opening the spigot or taking it if necessary?
Okay.
If so, what are the phases and what would cause you to tighten the restrictions or go all online?
So I can start with that. We have talked about some of the phases, but I'll quickly summarize them. We are starting with our pre-arrival quarantine period for students. Then our campus quarantine is phase 1, and that actually begins August 18th when our first group of student leaders arrives. We have a staggered arrival, so there's 3 different dates, and we will be in campus quarantine during that phase with those strict restrictions. I showed just of the table, but you're welcome to go to our webpage and see all of the details for that phase. Our stabilizing phase is phase 2. I only share this date because we're keeping this in mind, but around September 15th, we would hope to move into that phase 2 and only if health conditions allowed. And then our phase 3 would be sustaining, and that would happen several weeks after phase 2. But again, it will be a day-by-day decision. And maybe I'll let Mark talk a little bit about the metrics.
Thanks, Jen. Yeah, there's, as I mentioned in the presentation, there's just a lot of different things to look at, both on the state and national level, our regional health network, our local health network, our students following community standards. There's just so many different things that paint that picture. It's hard to pick just one item and just look at that in isolation. It really needs to be seen as a whole. And I think early on, we will have enough PPE, so we don't have to worry too much about those kinds of things. It's going to be how many cases do we have on campus, and then what's going on, I think, locally and regionally. And also, as I mentioned, the student behavior is a big piece of it. They have to, in a way, earn their way into that next phase, and that's part of the messaging as well.
Just to remind everyone, in the slide presentation that we've given, there is a very detailed set of metrics because we know that's so important to the community. And the slide is called Metrics Informing Decisions Sample Table. And that gives all of the metrics as well as percentages of compliance that would give us the next level of making our decision. That's my first point. So please go to that table. That will give you everything that you need in terms of the complex, elements that we are integrating into our decision making. Number 2, to say that this table was developed to the questioner's point with the state of Vermont as a model, but and the slowly opening spigot. But again, as I said in my beginning comments, being even more conservative than the successful state of Vermont was conservative.
Okay, are we ready for the second question?
Yep.
Okay. What criteria will be used for the college to reverse its decision to have in-person classes?
Yeah, that's a great question. Clearly on everyone's mind. I think in terms of singular decisions, if the governor, certainly if the governor, the CDC, the Department of Health said, look, you need to go remote, the conditions are deteriorating quickly, that would be an easy thing to do. Or if the virus became more virulent, more lethal, was affecting more people more quickly. I think that beyond that, looking at the slide that Lori mentioned, looking at all the different metrics, I think if we had lots and lots of cases on campus, and we felt like it was going to be hard to meet isolation or quarantine needs, or students weren't meeting the goals we've set forth for them, I think we would be looking at first backing into a more restrictive phase, such as a campus quarantine, going into our phase 1. And then if we needed to, we would continue to go remote. I want to point out, in March, we were one of the first schools to go remote and to make that decision. And that was as soon as that was an interesting day for me and for members of the senior leadership team when we realized that we were going to have to do that. There wasn't a lot of precedent, and we felt like we needed to do that for the safety of our community. So much has changed now in terms of our preparedness level, the education we can provide, what our partners can do, what the Department of Health has been through and the resources they've brought to bear, our PPE supply, our testing capabilities. We're in a much different place. We have isolation dorms that we can move students into immediately that didn't exist in the past. So I think we're in a different place than we were in March. But I know that our college administration, Lori in particular, feels if we can't do it safely, we will not do it. So I guess that's the best answer I can give you. Lori, I don't know if you have anything to add on that.
And no, I think that the key thing will be not one single factor, but a number of combinations of factors. And because I know this group and our senior leadership team and the work with the town, which we are very highly connected with and often speaking with pretty much on a daily basis for our emergency management team as well as our crisis leadership team. They are the folks that we are in constant consultation with. And so as we work with them, we're going to be really clear with them on what we're seeing. So those updates on our metrics in that slide will be incredibly important for the community, and we will be providing those, each one of them, what are we looking at, all the slides that Mark showed in terms of availability of beds, what are we looking at in terms of student behavior, what are we looking at in terms of the state and what is happening in the state and so on. So we'll be as vigilant about those table of metrics and updating the community pretty much on a daily basis as we move forward.
Before we move to the next question, at the risk of totally dating myself, I'm feeling a little bit about Lucy from I Love Lucy. I'm getting inundated with questions in the chat, inundated with questions on my email. So I'll do the best I can to get all of those out, but bear with me as we go on. Okay.
Kathleen, is there anything I can do to help? Do you want me to read? Are you reading the questions that?
I'll go ahead with this next question. Regarding the flu shot requirement, is the college procuring its own supply, and will it administer the vaccine, or is it likely that students will utilize local providers? If the latter, has the college engaged with local medical providers and pharmacies about the likely need for additional units?
Thank you. I'll answer that one. We have a flu vaccine is going to be required for all students on campus or living off campus but studying on campus. And we have purchased the vaccine. We will do it at our own, we'll use our own staff to provide it. We are talking to Addison County Home Health and Hospice about whether or not they want to partner with us. If they choose to do so, great. If they don't, then we will go ahead and we have the capability of doing that. We'll probably do that through our, as part of our testing, twice weekly testing centers. I do want to put a shout out though to Addison County Home Health and Hospice. They've been great in terms of reaching out and offering help. They're just fantastic. I think we can go to the next question.
Does Middlebury College have sufficient testing capacity to meet its testing requirements as outlined in the Return to Campus Guide? What contingencies do we have for shortage of tests or significant delays in getting COVID-19 test results?
Thank you, Kathleen. We definitely have the testing capacity we need. That's a huge issue. And you've seen in the press, some schools, other schools in the country have decided to go fully remote because they couldn't secure the testing. We were one of the first schools to connect with Broad Institute. And they have, you should check out their website. They have incredible capacity and they're dedicated to providing that service to not just colleges and institutions of higher education, but also municipalities. They help with Department of Health testing and UVM Health Network testing. Right now, they are a trusted partner, and we're excited to have them be part of their program. I am setting up contingency, lots of conversations with vendors. We ultimately went with the Broad. Once the case count started rising across the country, I realized testing might get scarce. I'm in final conversations with a couple different vendors to make sure that we have the capacity that we need in case Broad goes down. I don't think it will, but we'll have a plan if it does.
Mark, in a related follow-up question, is this testing going to be PCR testing? And will the results be reported to the Vermont Department of Health?
It will be reverse transcriptase PCR testing. Yes, it's diagnostic. It is not an antigen test. It is the PCR test that that is the gold standard right now for diagnosing COVID. Very high sensitivity and specificity. It is a great test. And there was a second part to that question, Kathleen.
Are you reporting them to the Department of Health?
We are going to report. We're definitely reporting positive cases. We're going to keep the statistics and get that to them as well. We're working with them how to do that. The Institute has a different software. Imagine whenever you're dealing with new software, there's things to figure out. We have our first walkthrough clinic tomorrow to test and do some training. And we're going to try that system and we're going to figure out how to use it. It's not that hard. I think we'll do just fine.
Great. Thank you. What happens if a student tests positive for COVID-19? Will they be quarantined and will the college's health center care for them? The questioner was concerned about the impact of an outbreak on Porter Hospital's resources.
I share that concern. We share it every day before COVID even reared its ugly head. It's a big part of our planning. So if a student tests positive, we're going to isolate them, starting with Mumford House. We'll provide there's a host of resources available to that student: medical, mental health, residential life support, dining. We can provide a lot of services. At this age group, the likelihood of having severe illness and needing hospital level care is very low. If they do, we've been meeting with Porter. We meet with them regularly through our community connection, but we've stepped up those meetings recently because we now need to hone in on workflow and processes as realities of testing, hospital capacity, et cetera, become clear. In that meeting this week, we talked about making sure that we take care of what we can take care of to help preserve Porter resources. I think we have a good partnership with them, and we're going to keep communicating with them. Is it possible that someone on our campus might be sick enough that they need hospital care? Yes, but I think the probability is very low given the age we're talking about and the measures we have in place to support students. We're ready to do that.
Shifting gears a little bit, how will you ensure that students will stay within the campus bubble and follow protocols? The questioner was not confident that 18 to 21-year-olds will follow the rules.
Not able.
I think Derek is muted. If we could unmute Derek.
Hi, everybody. Sorry about that. I'd be happy to answer this one, and I think that Barbara McCall will probably have some useful information to contribute as well. So this is such an important question. The key is that we don't intend to rely on any single approach to help manage student behaviors. As Barbara described earlier, there are proven evidence-based approaches to health behavior modification, which we'll certainly employ. But in cases where our health education measures aren't sufficient, a firm conduct response will become necessary, and we're prepared to mount one. We're clearly and repeatedly communicating our expectations as well as what responses students can expect if they choose not to comply. And while personally I ordinarily prefer not to work in this way, I don't want to downplay the deterrent effect, which will become real and significant if we're forced to send students home, as we're absolutely willing to do. But I also want to point out that there are significant incentives to student compliance, as others have mentioned. Students want to be back, and they realize that their behavior will impact our ability to pull this off successfully. They want us to be able to advance through phases of reopening and be granted increasing freedom if the public health situation makes that appropriate. So in addition to education and a firm conduct response, there are also lots of positive incentives for students to comply. And we believe that all of these efforts employed together will be effective.
I think I can speak to that exact point, Derek. I was taking a look at the data that's coming in so far in the last 24 hours from our health education survey. And while I haven't had time to mine the data to see how representative the sample is, we're seeing almost a quarter of our students respond to us in this first day that it's been open. And there was a question about benefits. We asked students to rank in order from the biggest benefit to the smallest benefit. What were the benefits that were most important to them when they thought about complying with our COVID-19 health behavior modifications? And students consistently ranked protecting others and the community as number one, their ability to safely return and resume their academic career or to begin their academic career at Middlebury as number two, and third, their own health and safety. And I think that is really telling, particularly when compared to some of our peer institutions. The survey that we've used is actually a combination of a number of questions that schools who released plans a little bit earlier than we did had used before their plans went out. And overwhelmingly, our peer institutions were finding that students were consistently ranking their own health and safety first, and then their ability to return to campus, whereas our students have put community and protecting others from COVID-19 as number one. And so if there was any other indicator, I don't know a better indicator than that, I should say, to see that that's the number one benefit that our students are seeing, responsibility for others within the campus community and then also within the greater town community.
Thank you. Where are off-campus students living, and what protocols are they expected to follow? And how will the college know if they are not following the rules? Is there a plan for monitoring them? What about students who live outside Middlebury but in Vermont?
Yeah, I'd be happy to answer that one. It's absolutely essential that we know where off-campus students are living. As in all years, we require students approved to live off campus and study in person to register their addresses and their landlord information with our housing office. That process is underway now. But what's new this year is that we're also requiring all students living in the state enrolled for remote learning or on a leave of absence to provide us with their addresses. They haven't done so yet, but we have a plan in place to collect that information. And I want to be clear, non-compliance with that expectation would itself be a conduct violation. So we're taking the need to collect this information really seriously. I think the next question was, what protocols are these students expected to follow? All are expected to follow state health and safety protocols. All are subject to our disciplinary processes. And that includes things like group size limitations for gatherings and so on. So we have, again, a scope of oversight that extends to all of these students. In terms of how we'll know if they're not following the rules, well, first of all, I'm quite sure that community members will appropriately bring concerns forward, but we're not relying on you to do the work for us. We'll be conducting periodic in-person check-ins in-town rounds at houses where students are approved to live off campus, so we have eyes on the ground. We'll be checking in with them remotely on a regular basis. Each house in which students are approved to live and study on campus will have a designated contact person that will be regularly in contact with our Office of Community Standards. So we have a number of methods which we'll use to stay in touch with them and monitor their behaviors. And I think the last part was about students in Vermont, but not in Middlebury. So they too are under our scope of oversight, as all our students are. And if we become aware of problematic behaviors, we'll certainly be prepared to respond. The specifics of our response, of course, will depend on the circumstances of the case, but they remain under our scope of oversight.
Thank you, Derek. How will you enforce your conduct policies when students are in violation of your health and safety protocols? Who is in charge of enforcing off-campus COVID-related health and safety requirements?
I'll take that one as well. So the Office of Community Standards is the primary office responsible for enforcing our expectations around COVID-related behaviors and all other disciplinary matters, both on and off campus. It's one of the offices under my purview, so ultimately it's my responsibility through that office. We will apply an administrative process by which the Associate Dean of Community Standards, who heads the Office of Community Standards, will consider and make determinations about concerning reports. Our responses will be rapid and they'll prioritize health and safety. And as I mentioned earlier, our sanctions may rapidly escalate to removal from campus or suspension. They might include no trespass orders and so on. To ensure fairness, students will of course have the right to appeal. But to prioritize health and safety, we'll need to quarantine those students while any appeal is considered. And we'll resolve those appeals within 24 hours. So a rapid and efficient process that ensures some fundamental fairness run out of the Office of Community Standards.
Thank you. And the last of the prepared comments is a suggestion. Landlords should provide their contact information to neighbors in case there are any concerns about their tenants' behavior. Landlords should have strict provisions in their leases requiring strict observance of state and federal COVID-19 guidelines. Not a question, just an observation. So Heather, we have, we've run a little bit long, but we do have several, we have one raised hand and a couple of questions in the chat. Should I admit the first person?
Sure, and I did get one question by chat to me also too, so.
Okay, so I will unmute Dave Silberman. And to all of our speakers, thank you. We set the mute button so that once you're muted, I have to unmute you. So I apologize for that, but if you need to be unmuted, just text me or chat me and I will unmute you. Okay.
I can help with that too. If people want to send me a message, I can also help with that.
Okay. Go ahead, Dave.
Kathleen, and thank you to the college presenters. This is very informative. Well, the college students are valued members of our community, and I'm very concerned for their health and safety as much as for the rest of ours. I'm very concerned about the plan for random testing. You've indicated that you're going to do random testing of about 750 total tests per week, but you have a campus population of students as well as faculty and staff that will come in contact with students of about 3,000. The best practice for congregate living is to test everyone twice a week. That means you're doing about 1/10 of the testing that you ought to be doing. Because
15 seconds.
no matter how great the practices and policies are, it only takes one person to bring it onto campus where it will spread before it's caught unless you test everyone twice a week. So with your capacity, you could test everyone twice a week if you do pool testing. So will you do pool testing? Thank you.
Thanks, Mr. Silverman. I'd like to answer that question. I appreciate your concern for our students and our community. In terms of the testing capacity, the actual, what's called assurance testing, looking for pre-symptomatic or asymptomatic cases, is actually not a recommendation from the Department of Health. They recommend we don't do that. The CDC doesn't recommend it, and the American College Health Association doesn't recommend it, yet lots of institutions are doing it. So it's hard to call it a best practice. I think it's a common practice. There are other colleges in Vermont that are not doing it. UVM is doing it and testing many of their students, but other colleges and institutions aren't. So I don't know that we can call it a best practice. We didn't feel comfortable doing zero testing, but I also think that when you do high levels of testing, there's a false positive rate because it's not 100% sensitive or specific. And you have to, instead of testing people that have a very low probability of having the disease or having the illness, you actually may cause people that don't need to be quarantined or isolated to be quarantined or isolated. What we're going to do is targeted dynamic testing. We're going to pick individuals that might be at higher risk based on activities that they're doing, such as I think about performing artists, teachers working in labs, front-facing custodians, public safety officers, healthcare workers, those individuals, and we're going to do testing. What we can do is if we're starting to see an increased rate of infection, we can ramp that testing up to include more numbers. We have that capacity with the Broad. If we're not seeing that, we're just going to keep going and we're doing some low-level surveillance testing. It does exceed the Department of Health recommendations. It far exceeds the Department of Health recommendations. And so I feel really good about our testing program. Thank you.
Okay, I think we lost Kathleen. So Chris, if you could help me, I don't see any other hands raised. I do have one question in the chat here. I can go to that person. Erin Davis, I'll read your question you sent me. She sent an important part of safe reopening is that staff and faculty are also included. We need to compensate essential workers with extra hazard pay and/or premium pay and allow for extended sick leave so that staff and faculty feel okay calling in sick without losing pay. How much hazard pay will essential workers be offered, and how will we offset the risks of this dangerous work for Middlebury workers?
Thanks for that question, Erin. Is David Provo on the line? I believe, and Karen Miller are the two people that would be able to address that. I think Karen's with us.
Okay, let me see if I can find them.
David's here
I
with
see
us.
Karen.
Great.
I'm trying to unmute her now. Sorry, it doesn't seem to be working.
Yeah, I'm on.
Yeah, she's on.
Oh, okay.
I'm on now. Thank you. Yes, we have given consideration to hazard pay and for employees. I think working with Jen in terms of making sure that we are taking the kind of protocols to ensure that our staff are safe, putting in the proper hazardous controls. We have not reached a determination at this point that we will be doing that, but it is something that we've had in our conversations. With that, I don't know if David wanted to add anything more.
I apologize. I'm having trouble finding David, and he may be.
Provo is the last name.
He's on.
I believe he's unmuted,
Okay.
Heather.
Okay, thank you, Chris. No, he looks like he's muted. I see him now.
Okay.
Right.
Oh, there he goes.
Thank you. Yeah, the only thing I'd add is, you know, dating back to March, the college has made a commitment to supporting our faculty, staff around wage continuity. It has been a commitment from President Patton since the pandemic arrived with clear uncertainties. So, you know, our commitment to keep our folks whole has been really a fundamental principle of our planning. And as Karen mentioned, as we contemplate hazard pay, we are looking at that. But our first and foremost function is about how do we maintain the continuity of wages for such a large portion of our population in Addison County. And that's really important to us. And we've worked very hard to do that to the point of hazard pay. We are, as Karen mentioned, we're looking at it, and we will be sharing information as we make decisions.
I just want to add here that I think it's really important to acknowledge that this is a concern for folks, and that right now our focus is on providing safe environment that, again, exceeds the Vermont guidelines, and that right now, because of that, we don't see the reason for hazard pay because we are already exceeding the state guidelines. That being said, it's very important to acknowledge, and we're working with every single employee. We have set up so that there are about 6 or 7 different backups for our staff members who are concerned in one way or another about their work situation. No employee will be allowed to return to work until the safety check that has already been set up as a protocol, office safety check, has been completed by Jen Kazmerzak. It's very thorough. And once that happens and it is deemed safe to return, then only then will employees be able to return to work. Most of us who are able to work remotely are being asked to stay and work remotely, which is another part of our safety commitment. Another thing, third, that I think is important to let folks know is that many, as I survey the landscape of higher education, many of our peers have moved to cut benefits and pay. We have had an open and robust conversation about how our values and our budget work this spring. It was an incredibly good one, very tough, tough-minded for all of us in a really good way. And we made the decision with the approval of the board that we would not be moving in that direction for now. And we're really pleased to be able to keep people whole in the way that we have. And that is a commitment to this community as well as to our incredible faculty and staff.
Thank you. So I see Kathleen back on. I do not have any other questions or see any hands up. Kathleen, do you have, or Chris, do you have other questions?
Unfortunately, when I was disconnected, all of my chat disappeared. So if anyone wanted to raise their hand that was in my queue, they could do that.
So at this point, if people would please use the raise hand feature, and if we see hands go up, we can open up the floor.
Heather, I also just wanted to say, for time's sake, we have this wonderful COVID info at middlebury.edu that we will also be able to answer any questions. And we've already made a commitment whenever we do one of these Zoom calls to have all questions that are submitted answered. So if time is an issue, we will be happy to answer every single question that comes in. COVID info, we have the team set up to be able to do that.
Thank you, Lori. Certainly, if members of the community think of questions, please take the college up on their offer and submit your questions by email so that they can respond to you, please. I thought I saw a hand go up. Okay. Oh, I do. Hang on. Let's see if this works. William? You should be.
Can you hear me?
Yes.
Okay, thank you. And thank you to President Patton and everyone at Middlebury for putting this together. I do have a question. Can you tell me, just give me a rationale for having so many students return? And I'll ask you a number of questions about that. Fewer than 50% of courses are in person, and the huge majority of courses are not at all in person. We were told at one point it was very important to reopen so students could come back for the learning experience, but they're going to be learning remotely like they did in the spring. So why is their presence here so important? Leads to my second question. They're coming, they say, to be together. Well, parties are not allowed.
15 seconds.
Sorry, Derek, I hope you're right, but I don't think it's right. So I'm just wondering, it's going to be a weird experience. Why have them all come back? Why not have some come back?
Derek, you want to start and then other folks can jump in?
Sure, I'd be happy to. So maybe I'll just start by sharing a little bit about what the level of student presence on campus we project will be. I can certainly understand how the impression that we're packing students in would be very troubling, but I want to share a few points that illustrate how that's not our approach. First, unlike many of our peer institutions, we're really fortunate that we start off with a housing inventory that's about half singles to begin with. This means that we have a relatively low housing density to begin with. So we also are tracking student numbers very carefully. And at the start of a typical semester, we'll have 2,450 to 2,500 students in the fall here. When we account for the numbers of students who've indicated their intention to study remotely, who've elected to take leave of absence, if we're able to open tomorrow, we'd be at about that level, but we project that we'll continue to receive additional leave of absences, remote study notifications, and unfortunately, we're also anticipating that a substantial proportion of our international students won't make it back to campus. So when we take all these factors into account, without setting any set in stone delineations of students, for example, not permitting a particular class to return, we're projecting a reduced campus density in any case. So we're gonna get there without taking any of those more drastic steps. Of course, the other advantage we have is that we have places like Breadloaf to help further reduce density. So we have ways to manage the density. In terms of the value of students returning to campus, there are profound benefits in terms of students' mental health. There will be engagement with faculty and staff on campus, despite the fact that many of the courses will be remote, and I'm sure others can articulate that further. But I just wanted to start with that sort of snapshot of the real information on student density.
Is Jefferson, go ahead, someone else was gonna, is that Barbara? No. I thought there was somebody else who was.
Well,
I'm happy to chime in quickly, Lori. I was just going to offer to the point about parties, that actually the data that we're seeing come in from our health education surveys, that students are themselves concerned about parties and about folks respecting the kinds of COVID-19 health behaviors that we're asking them to follow in gathering settings. And we asked a question that provided a number of contexts for students, and we asked, how confident would you be in these scenarios? Asking someone to back up and give you some more space if they're too close, asking someone to adjust their face covering to wear it properly or to put one on if they forgot. And I was actually surprised. The scenario in which students overwhelmingly said that they were the most confident was refusing an invitation to a party or gathering on or off campus that they anticipated would not respect or follow the COVID-19 guidelines. That was well and above, by and far, the scenario where they said that was clearest to them and that they felt most confident in saying no thank you and making a different decision.
Mark, do you want to respond from the perspective of a density question and the health question?
Yeah, sure, Lori. In terms of the density, I think Derek addressed that in terms of the dorm space and the rooms. Some of the other things that are happening are creating outdoor spaces for people to gather. So we're giving them things, we're giving them spaces and positive modeling about what they can do, how they can spread out in smaller groups, still get together, and not have, I think what everyone is concerned about, the large out of control gathering. In terms of the health and safety pieces, the messaging that's going on around the importance of physical distancing, the importance of wearing face coverings, and all of the measures that we've been discussing, I think will help that convey that message and be positive reminders. And it's interesting when I talk to the students that are living in town right now, spending their summer here, and others that I happen to speak with. And I think Barbara hits the nail on the head. They are very concerned about their health. They're concerned about the health of our community on campus in town, which is so reassuring to hear. I think that's the reality we're seeing. And that's the answer I would leave it.
Is Jeff Kaysen on the call? Or Suzanne Gerland? May not be. Okay, so I think the other really important, first of all, William, I really appreciate your question. I think it's a really important and good one. The numbers that we have right now from Suzanne Gerland's office, our Dean of Curriculum, is that about 50% of courses are completely online and about 37% are hybrid. Which means a combination of in-person and online, and 13% are in-person. So I think it's a really important thing to think about if we're looking at just an in-person with classes in person only. That's a judgment call that I think folks and students themselves can and should make. And we expect that we will be seeing students making decisions around that. It's something that is important because it's a reality of choice. Faculty, as you know, have total choice as to how they want to teach their classes. So I think it's very important to allow students themselves to choose. That's part of the reason why we project that we will actually be at a lower density than what we designed as a maximally, a campus that maximized safety. And so that is also reassuring to us. I think what we're seeing is that in-person interaction that students want and want to engage with are also not necessarily only in-person classes, but tutorials, walks outside with advisors and professors, socially distanced activities, et cetera. So I think that what we're seeing is that kind of engagement is where students are returning. So those are the numbers today. We're letting students choose, and we do expect that some students, precisely for the reasons that you rightly point out, may say, you know, and we're seeing this as a national set of choices that students are making too. Maybe this is a time for us to learn remotely, and we will support that 100%. So we are very much open to those choices, and we're also trying to support the in-person engagement in ways that we think maximize safety. Just as a point for folks, I will be myself teaching an in-person class because of the confidence I have in the work that my team has done.
Thank you. I have one hand up, but it was a person that's already commented. I wanted to make sure to give the select board members a chance to ask questions if they had them. And then given the time and the fact that we have many additional agenda items to cover this evening, along with the executive session, I would request that if people have additional questions, they send them to the college directly for responses. So do any of the members of the select board have any questions that haven't been answered so far this evening? Okay, then I think I'm going to wrap up this portion of the meeting for tonight. I would like to thank all of the members of the Middlebury College senior staff and others who have presented and provided all of us this information tonight. It's very much appreciated. It was a great presentation. Thank you. Thank you for being here with
Heather,
us.
I do have one point.
Oh, I'm sorry, Nick, I couldn't see you.
That's
Go
okay.
ahead.
Yeah, okay. And I'm going to shut the video off because I keep getting this message at the place I'm working that says you're unstable. I think they're talking about the video. At least that's my hope. First of all, thanks. This was a good presentation. You know, in my professional world, it's risk analysis, management, and mitigation. And as was described by some of the presenters, what the college has done is it's a logic and science-based. And so that's how I reviewed the information that came in advance and how I was observing how you presented today. I'll say it's a very good presentation. One that I feel like I've taught similar versions with different emergencies, but stuff where I'd really like to use some of the information you had. By the way, Jen, from one engineer to another, nice tables. So that was excellent. But what I could say in brief as I think about this and look at it, I think, you know, the college all along has showed that they've been fully aware, and this goes really back to the very early stages and some of the early calls. You know, they're aware of this emergency and the seriousness of it. I think they've been very professional, and what I've see the effort that's been done so far really gives me a lot of trust in the work that's been done. It's really very top notch. And the fact that you've also obviously been consulting with health and science experts and government officials who are tracking this is also very positive. I see a plan that seems very appropriate, you know, to maintain the safety of our community and our region, while also allowing some resumption of the college experience. So I think it looks very good. I also appreciate the fact that you've addressed the issue of the dynamic aspect of this emergency, so you have contingency plans for that. I've heard from some sort of implication that you know, the students may not take this serious and they may be risk averse. I don't buy that. You've certainly mentioned this quite a bit in your own experience, but as I've talked to family members who are students and friends who, sons and daughters who are students and neighbors who are students, they are very serious about this. You know, one of the themes that many of them have said is that we feel like our spring semester, our spring college experience was ripped out from under us, and we don't want that to happen anymore. We want to have the aspect of learning in the college campus, and we want to do everything we can to make sure that we aren't part of the problem and that we're part of the solution. So I feel very comfortable. I think these students are very, very capable. They're very smart, and we have to give them credit for what they will offer us. And so I'm very comfortable with this. One little item of barriers was mentioned for off campus, and I never saw anything about this, but I suspect it's in there somewhere. Because I think in the case of my own son and daughter, when they were living off campus, was acquiring food. And so it seems that the one aspect, if they're going to be expected to quarantine in, is how would their food be arranged? Are they going to be expected to come in and notified to come in with 2 weeks of supply, or is there an arrangement for that? But other than that, nice work and thanks a lot.
Thank you, Nick. That's great. Very briefly, and then I know we need to sign off. We do have, and I know David Provo can speak in detail at this, but Dan DeTora, our head of dining, has an awesome plan already for food delivery for each stage of our quarantining students. And I've been very impressed with his plans so far. So he's got that completely covered. And we also have a core of folks who are going to be delivering and during our first 7 days when we're going to be doing the testing. David, do you want to add any more on that?
I don't think it's really necessary, good Dr. Patton.
Okay.
I knew you had something on it, and I just
Yeah. We're
it was just
actually,
an issue.
Dan is really psyched about his plan. He's it'll be good, and David is nodding. Okay, we're going to cycle off, but I would just want to say on behalf of our entire senior leadership team, as well as all the faculty, staff, and students that we've been working with, one of the greatest joys for me of this work in higher education is working with the citizens of Middlebury and this town. It has already proven to be the case that we have that special relationship that was started at our beginnings more than 200 years ago. It was proven very deeply to all of us this spring and into the summer with how well we've been working together. I deeply trust and admire the officials as well as the citizens of this community. We are going to be depending on you in collaboration to continue to work into the semester where we can deliver on our educational promise in a way that maximizes safety. And we are deeply grateful from the college for all your help. Thank you so much.
Thank you, President Patton. We very much appreciate it. To Aaron Davis, I believe it was Aaron. I know you had your hand up again. We're about 45 minutes over. I have about 10 more agenda items. Please use the college's email to reach out to them to ask your additional questions, please. I apologize for not getting back to you, but I really have to move the rest of the meeting on. So thank you again to all the Middlebury College participants and all the members of the community that came out tonight. We really appreciate all your input and attention. Thank you. Okay, I see Brian on. Brian, are you interested in taking over chair, or would you like me to continue?
Am I unmuted now?
Yes.
You can go ahead, Heather. You're running this meeting. I was listening to it, and I just got home in time to pop on towards the end here. So go ahead and finish the meeting.
Okay, I just wanted to give you the opportunity, and if you so desired. Okay, let's move on. So the next item on our agenda is the annual appointment to boards, committees, commissions, and official positions. We have on the Development Review Board, we have 2 open positions and 3 candidates. 1 alternate is permitted. Should we start there? Pleasure of the board. Is everyone on the select board? Can we make sure that you are unmuted so you can comment? Okay. Do we want to start with that discussion?
Are we doing the DRB first?
That was my suggestion. I'm open to whatever the board would like.
How about just start at the top or something?
Shall we start with the DRB?
Sure. Or
I would
so
vote
let's start with the 4 in our agenda notes that have more candidates than positions available. So let's start with the Development Review Board, the DRB. Let me hold on. See if this works. Okay. So,
Not right now. Please. Not right now.
Ann Taylor and John McIntyre have both indicated they'd like to continue. And then we also had an additional new applicant seeking appointment, Mark Welch.
Well, they're certainly all good candidates. And in fact, I was really glad to see Mark. I've known Mark for a number of years step forward, so that's good. But for continuity, I personally would like to move to appoint Ann Taylor and John McIntyre to the Development Review Board and Mark Welch as the alternate.
Okay, is there a second?
I'll second it.
Yeah.
I'm going to go with, I think I heard Lindsay first. Thank you. Is there any other discussion on this? Okay, all in favor of the motion. So while I'm sharing my screen, I can only see 6 of you. Brian, I can't see you. So maybe just use your voice, Brian. All in favor, thumbs. Brian, are you voting?
Aye.
Okay, I can see you now. I don't know who dropped up. Okay, let's move on. So the next one is the Addison County Regional Planning Commissions, 4 applicants, and we can have to 2 alternates permitted. Would someone like to make a motion?
I'll make a motion to accept all the candidates, right? For the Anderson County Regional Planning Commission.
So I think in this case, Farhad, we have to name who are full members and who are alternates.
Okay, so we have a total of 4 applicants, right?
Yes.
Yes.
Andy Hooper, Ross Conrad, Hugh McLaughlin, and Jilly Dos Santos. So I'll make a motion to have Andy Hooper, Ross Conrad, and Hugh McLaughlin as delegates, and Jill Dos Santos as an alternate.
Okay, is there a second? Is that Lindsay?
Yes.
Thank you. Any discussion, comments on the motion? Hearing none, all in favor, thumbs up. I can't see somebody. Victor, can you use your voice?
Yes.
Thank you, Victor. All right. Infrastructure Committee.
Infrastructure.
That must be up. Nope. Hold on.
It's all the way down.
All right.
There it is. Thank you. So we have Chris Robbins is not seeking reappointment. Gary Baker is. So we have 2 positions available, and we have 4 candidates. We do allow 1 alternate. Farhad.
Yeah, I would like to nominate Matt DeBishop, Gary Baker as a regular member, and perhaps Eric Emerson as an alternate.
Okay.
Second.
Thank you, Victor. Thank you, Farhad. Were you going to add something more, Farhad?
Yeah, I was just giving you a reason for Matt, because he applied only for the infrastructure committee, and Eric and Adam has applied for multiple positions. So if you want diversity, we'll have everybody on something.
Okay. Any from Victor? Is there any comments, discussion, questions on the motion? Hearing none, all in favor of the motion, please indicate with a thumbs up. And Nick, I can't see you right now, so if you could use your voice.
Aye, Heather.
Okay, it looks like we're all in favor. Thank you. All right, the next one is Middlebury Area Land Trust. There is one position and 2 applicants. Would someone like to make a motion?
What was the other committee that Eric had also, Eric, we just accepted Eric on infrastructure.
Yes.
And he's on a third one somewhere too, right?
He had asked about planning commission, or he had applied to planning commission, which is another big one. So I think if he's doing infrastructure, because planning commission meets twice a month, right?
Yeah, at least.
I forgot what the planning commission.
But planning commission is already slated, so there's no contest there. So he's already on it.
Okay, so then he shouldn't be on Mo.
Exactly.
Got it. Thanks.
Would make a motion.
I'll make a motion to appoint Christopher Brooks on the malt board.
I second
I
it.
didn't.
This is Dan. I second it.
Thank you, Dan. And say someone else's name.
It's okay.
Okay. I'm sorry. Okay. Any other questions, comments about the motion? Okay, all in favor, please indicate a thumbs up. Brian, I can't see you, so if you would voice. Brian, did we lose him? Can he not? Maybe he can't unmute.
He's muted.
Okay. There.
So you don't get all the background noise, I mute myself, but I cannot mute
Can't
myself.
unmute. Oh, okay.
I vote
I'll-
yes. I had the same rationale. I was actually trying to nominate him. So
Here, let me get out of, well, here, so are there any other, so we voted on that. Let me get out of the share screen, unless anyone wants to see the shared screen anymore.
No, I have my other.
Okay.
I have mine.
Okay, all right, let me get out of share screen so that I can see everyone now. All right, so then we need to have a motion for the remaining appointments to the non-competitive positions. Would somebody be willing to make that motion?
I move it.
Thank you, Victor.
Okay.
Thank you, Lindsay. Any other comments or questions on that? Okay, all in favor indicate with a thumbs up. I can see everyone now, so. Okay, all right, we're all in favor. Thank you. All right, moving on to number 9. Set revised property tax payment due dates to November 15th, 2020, January 15th, 2021, and March 15th, 2021 in response to COVID-19. The voters at town meeting approved August 15th, November 15th, and March 15th, 2021. The governor on his May 14th address allowed municipalities to postpone collection dates of both municipal property tax and education property tax. In response, we're being asked to set revised property tax payment due dates. Sorry. All right, would someone like to make a motion?
I move to set revised property tax payment due dates for FY21 to November 15th, 2020, January 15th, 2021, and March 15th, 2021 in accordance with Act 102.
Second.
Thank you, Victor. Thank you, Farhad. Dan, you have a question.
I just have a quick question with moving it out to November 15th. What is, I run my business on cash flow. What is it, Kathleen? What does that do for cash flow for the town? What do you rely on? You got to run out of money.
We
I think she
do.
dropped off, didn't she? You there?
Nope, she's there.
Is there?
We have sufficient cash flow to meet those collection requirements.
Okay. I figured you must, or you wouldn't have supported this thing.
Well, sorry that my internet at the town offices gave out again with the high-speed connection, which is what, 3 times tonight. But going back a little bit, the August 15th deadline wouldn't work for us this year because of the extension of the state income tax deadline, which we in turn use to calculate the homestead to issue the bills for the property taxes.
I remember that, yeah. This works well for me. I appreciate it too. And you probably should pay more money for your internet service at the town hall.
Okay, did anyone else have questions about the motion? Hearing none, all in favor, please indicate with a thumbs up.
I'll have chocolate.
Okay. Thank you. Can you tell I'm getting tired? All right. Let's move on. Jim, are you on? Let me unmute you. There.
Okay.
Yes. Can you take us through acceptance of the labyrinth gift for Lazarus Park, please?
Sure, happy to, Heather. Can you hear me okay?
Yes.
Okay, great. So last year, the select board approved a landscape plan for the new Lazarus Park, which will sit alongside Printer's Alley. And one of the features of that new park is a labyrinth composed of a set of pavers that will sit at the very bottom of the Lazarus Park. And that was an idea that several folks got excited about, was incorporated into the landscape plan. The idea came from St. Stephen's Episcopal Church. And so VTrans liked the idea, but it wasn't considered a participatory cost from the federal highway. And so we had to look for another way to find funding for it. St. Stephen's stepped into the breach there and led a fundraising effort that raised $16,800, which is the cost of the pavers and delivery to the site. Kubricki will install the pavers in the labyrinth as they're working on Lazarus Park either later this year or early next. And so the construction part of that will be covered. And St. Stephen's has also volunteered to maintain the area. It'll be staying on concrete, so I don't think there'll be a lot of maintenance involved, but they've volunteered to do that. So I think that the labyrinth is a really great idea. It creates kind of a meditative space at the bottom of Lazarus Park, but also kind of a playful space too that kids can come down to and enjoy. It gives people a reason to go down through Lazarus Park and then eventually off to Marble Works. So tonight you're being asked to approve a letter accepting the gift from St. Stephen's on behalf of the town, and also to approve a request to purchase the Labyrinth kit, which is from a Connecticut company called the Labyrinth Company under the sole source provision of the town purchasing policy. Again, the cost here is $16,800, and I've delivered a check on behalf of St. Stephen's to the town for that amount.
Thank you, Jim. Thank you very much to the St. Stephen's Church. I think this would be a wonderful addition to that park. We need to do 2 motions this evening. Would somebody be willing to make the first?
I'll move to approve the letter accepting on behalf of the town of Middlebury, St. Stephen Episcopal Church's gift of $16,800 to fund the purchase of a labyrinth to be installed at Lazarus Park at the completion of the downtown bridge and rail project.
Second.
Thank you, Victor. Any question?
Oh, sorry. Go ahead.
That's okay. Any questions, comments, discussion about the first motion? Okay, I'm sorry, Lindsay, go ahead.
No, I'm sorry. Just there's an extra 0 in there on paper. So.
Yeah.
Yes, you're right.
Okay, all in favor, please indicate with a thumbs up. Okay, great. Farhad, do you want to do the other motion?
Sure. I also move to approve the purchase of the Labyrinth kit from the Labyrinth company for under the sole source provision of the town purchasing policy for a total cost of $16,800 now. Dollars.
Thank you, Farhad. Is there a second?
Second.
Thank you, Lindsay. Any questions, comments on this motion? Hearing none, all in favor, please indicate with a thumbs up. Okay, we are all in favor. Jim, thank you very much. I apologize for the lateness and keeping you on so long. Thank you for being here, and thank you for coordinating this wonderful gift.
Oh, it's no problem at all. On behalf of the good folks at St. Stephen's who have played such an instrumental role in this project, I want to thank the select for approving this, and I'm really looking forward to see it being part of our new Lazarus Park.
Great, thank you, thank you. Okay, Dan, and is Dana here? Dana, hello. I'm so sorry to have you guys on so late in the evening. I appreciate you hanging in with us. If the two of you would please take us through the historic window restoration and window painting for the library, please.
Sure. The historic windows, I introduced this project almost a year ago now, and we did the fiscal year 21 capital budget planning for the library. We have 14 windows in the 1924 building that are in really desperate need of maintenance, especially new weather stripping. So we applied for a partial grant to fund this. We budgeted for it. We put the request for proposals out. And unfortunately, both of the bids that we received were a little bit higher than we anticipated. Willard Street Traditions, which was the low bidder, is very highly recommended by the Department of Preservation, and they were willing to work with us to break the project out into 2 sections so that we could address the windows with the most pressing needs this year with the funds that we have, and then address the remaining windows 2 years from now, which will allow me to apply for another round of grant funding from the Department of Historic Preservation.
Okay, thank you, Dana. I gotta flip my page.
Well,
so
yeah,
go
ahead.
I'm sorry, go ahead, Nick. Were you ready to make a motion?
I am. Good choice of a firm, Dana. That's they're well regarded. So my compliments to getting them. So therefore, I'll move to accept Phase 1 contract proposal from Willard Street Traditions for window restoration at Ilsley Library at a total cost of $15,000.
Second.
Thank you, Nick. And Victor, are there any questions or comments for Dana?
I'm just, again, I usually say this, the difference between the 2 bids is astronomical in my opinion. I don't know how, why these things happen between $34,000 and $85,000 between 2 companies.
Yeah, I was puzzled as well.
It's called the construction world.
Well, when we bid this, the Millbrook, the second firm, really had a hard time separating their painting estimate, I guess, internally with their restoration. We asked them to disclose, and they declined to do that. So it seems to me like it was almost a fishing expedition on, throw a price out there and see if it'll stick.
Yeah. Thank you.
Okay. Any other comments or questions? All right. Hearing none, all in favor of the motion, please indicate with a thumbs up. Okay, we are all in favor. Thank you. Dana, you want to take us through the window painting part?
Sure. This is sort of phase 2 of addressing all of the non-historic windows at the library. Last year, we scraped and painted the non-historic windows facing Main Street. This year, I'm hoping to do the same for the windows facing the back parking lot. There's 34 windows there. I only received 1 bid from Glenn Stearns of Stearns Paint. That's who did the painting for us last year, and it was they did fine work. So their bid was for $7,400. I was planning to pay for that with $5,000 from our capital budget for external repairs.
I'll continue since it looks like she's locked up. So, I mean, we're right to the request for the motion to approve Stearns for $7,400.
Okay,
Well, I'll move to accept the proposal from Stearns Painting and Papering to paint the 34 exterior windows at Ilsley Library at a total cost of $7,400.
Second.
thank you, Nick and Victor. So just to continue what I think Dana was going to say was, it was 5,000 from capital, correct, Dana? And then the 2,400 is coming from your,
from the operating budget.
yes,
Year
thank
20.
you.
Yep.
The operating budget, thank you. Any questions, comments for Dana? Okay, all in favor of the motion, please indicate with a thumbs up. Okay, we are all in favor. Thank you. All right. Dana and Dan, thank you both for hanging in here so long with us. I appreciate it.
Yeah, thank you.
So have a wonderful evening.
Okay. You too.
So next on the agenda is the finance and maintenance agreement with the Vermont Agency of Transportation for the passenger rail platform. I think we've lost Kathleen again, unfortunately. Chris, are you available to take this, or is it pretty self-explanatory based from our agenda notes?
I don't know. I don't have any in-depth understanding of this particular project, but I can tell you that it's mostly has to do with site preparation and the installation of utilities on the property in the rail right-of-way in preparation for construction, which should be the early part of next year. It's a standard V-Trans agreement.
Yes, thank you. It looks like a pretty standard finance and maintenance agreement. Does the board have any concern that they want to wait for Kathleen, or is the pleasure of the board would be to move ahead?
And move.
Second.
Okay,
So you want me to read the motion?
sure.
Okay, I move to authorize the town manager Kathleen Ramsey to sign the finance and maintenance agreement with V-Trans for site work and improvements within the rail right-of-way between Middle Seymour and Seymour Streets in preparation for construction of the new passenger rail platform in 2021.
Once again, second.
Thank you, Farhad and Nick. I appreciate it. Any comments, questions on the motion?
Heather, Kathleen is back with us.
Oh, I see her. Kathleen, we've made
I
a
am
motion.
not doing this intentionally. My turn.
But don't feel bad. I've been knocked off at least 5 times tonight. So we're doing neck and neck.
Okay. Well, it sounds like you guys have it well in hand.
Yeah. So we've made a motion. There wasn't any additional questions. It seems like it's a pretty standard agreement. So all in favor of, if there's no questions or comments, right? Okay. All in favor of the motion, please indicate with a thumbs up. Okay, we are all in favor. All right, approval of the check warrants. I reviewed the check warrants today. So under the authority granted by the Select Board on April 28th, 2020, I have reviewed and approved on behalf of the board total expenditures in the amount of $601,089.73, consisting of $492,632.46 for accounts payable and $108,457.27 for payroll for the period July 15th, 2020 through July 28th, 2020, and move the board's approval of the payment of these expenditures.
Second.
Thank you, Farhad. All in favor, please indicate with a thumbs up. Okay, we're all in favor. Kathleen, I can't do the town manager's part without you, so.
Here we go, while I'm still here.
Yes.
So just to note that the draft downtown master plan is available on the town's website. Folks have been submitting comments on it and your suggestions are welcome. So please reach out to town planner Jen Murray sooner rather than later, as the Planning Commission is going to be finishing up their work on the downtown master plan soon. You have in your packet the year-to-date budget results as of June 30. It's important to note that these are not year-end statements for our fiscal year, as we're still paying some invoices that we just received for FY20. That said, we are looking like we were slightly under budget with expenditures and right about on target with revenue. I will be submitting a more complete report, hopefully when we get most of those invoices paid early in your August 11th meeting for a full report. There's an upcoming virtual forum on economic recovery. The Local Solutions and Community Action Team of the Governor's Economic Mitigation and Recovery Task Force will be hosting an Addison County virtual forum on September 17th from 6:30 to 8:30 p.m. This is one of 14 community recovery visits facilitated by the Vermont Council on Rural Development that are being held around the state between July and October to share ideas and understand economic recovery challenges that communities are facing. Registration for the event is required and will be open 2 weeks prior to the event. If you have, you might want to take a look at the VCRD website to get ideas on the other community visits that they've already held. We will be the Addison County Recovery Team, which I'm on with Fred Kinney and numerous others. Will be helping to set the agenda for that community visit. So if you have any input on that, you may want to mention it to Fred when he's at your meeting on August 11th. Your VLCT 2020 legislative wrap-up is in your packet. The LCT is calling this an interim wrap-up, published as the legislature entered a 6-week recess on June 26. This document reports on the COVID-19 related bills passed during the legislative session that most impacted local governments and highlights the sections of the statute that were amended or added in those bills and effect they have on local governments. And that is all I have to report.
Great. Thank you, Kathleen. Are there any questions for Kathleen on her town manager's report? No? Okay, let's go to board member concerns. Victor, do you have any board member concerns?
No.
Okay. Lindsay?
Nope.
Ryan?
I was very happy, no concerns, but I was very happy to listen to the college's presentation. I think they've done a great job identifying the risks. I appreciated Nick's comments. I was thinking a lot of the same type of things as far as looking at everything that they've identified, how they've got multiple layers of addressing it. Certainly as a parent of 2 college-age kids, I feel we owe it to try to make this work for students. I just think that students are, they have rights too, and the right to get together and to develop and grow, and you can't keep them stuck at home forever. I just don't think their mental health is going to be very good if we try not to send kids back to school. And I think we owe it to try to get it right. And I'm just hoping that is our experience with this bringing the students back to Middlebury. So I'm looking forward to continue to work with them and make sure that we do get it right.
Thank you, Brian. Farhad, did you have any concerns?
I was utterly disgusted by the Zoom bombing, the racist nature of the Zoom bombing that happened. I think they are cowards to hide behind a keyboard and try to hijack a meeting, a very productive meeting. I thoroughly condemn it, and I think we should do something about these folks.
Break the
Okay.
quorum.
Yeah. Dan, did you have any concerns?
No concerns. Second, what Brian and Nick said, and Farhad, but I also want to say I was impressed with Lori Patton just carrying on through that and ignoring it. I thought she was wonderful with that. So, yep.
Thank you, Dan.
And Kathleen keeps muting me. Wow.
Nick, do you have any concerns?
Well, I follow up with what Fahad said, but he was actually kind in the word cowards. I had some other words, but MCTV would be blanking me out. That was just the lowest of the low life, and just, completely unacceptable, and shows that even in this contemporary day, we still have people who are just not good members of society. But anyway, we moved on, and appreciate the ability to continue on and not let that disrupt what was a good presentation. I don't know how many of you have been down watching the construction site. We're in week 3, and it is fantastic to watch what a real heavy construction project looks like. There's been a lot of visitation from members of the public of all age brackets, and it's kind of like the thing to do. So if you really want to see an interesting project going on, an interesting time in Middlebury's history, and you haven't, go on down by the St. Stephen's side of the job. You can stand right along the fence. Of course, wear your masks and don't get too close to each other, but it is fantastic to see what real professionals hard at work are doing. And thanks to Kabricki and V-Trans and everybody who's been part of this. It's great work so far, and I know it's going to be a fantastic completion. That's it.
Okay. Thanks, Nick. I'm all set. Nothing to add. So I think, would someone like us to make the motions to take us into executive session?
Sure. In accordance with Vermont open meeting law requirements, I move that the board find that premature general knowledge of the consideration of pending litigation would clearly place the select board at a substantial disadvantage, because the select board risks disclosing its litigation strategy if it discusses the pending litigation in public.
Is there a second?
Second.
Thank you, Lindsay. Thank you, Victor. Want to continue?
I further move that the board enter into executive. Oh, we need to vote.
I'm sorry, we need to vote.
Okay.
So on the first motion, all in favor, thumbs up, please. All in favor, okay. Sorry, Victor, now you can continue.
Okay, I further move that the board enter into executive session to discuss pending litigation under the provisions of Title I, Section 313A1 of the Vermont statutes.
Second.
Thank you, Victor. Is there a second?
Second.
Thank you, Lindsay. All in favor, thumbs up, please. Okay, we're all in favor. All right, we're moving into executive session at 9:33.